أعزائي طلبة المرحلة الثانية، السلام عليكم ورحمة الله وبركاته. اليوم محاضرتنا عن البريتونيوم. The peritoneum is a serous membrane that lines the walls of the abdominal and pelvic cavities. That's appear here in red color. Lines the walls of abdominal and pelvic cavities. It also covers or clothes the abdominal organs, covers the organs within these cavities. As in this figure, it covers the liver, covers the stomach, and the small and large intestine. So it is a serous membrane, lines the walls of the abdominal and pelvic cavities, and also covers the organs within these cavities. What are the functions of the peritoneum? It secretes a serous fluid that's called peritoneal fluid, support viscera and keep them in place, store lipid, and transmit blood vessels, nerves, and lymphatics for these organs. Peritoneum can be divided into two parts. Parietal peritoneum that lines the walls of the abdominal and pelvic cavities. Visceral peritoneum, from its name, it covers the viscera or the organs. And the peritoneal cavity, it is a potential space that lies between the parietal and visceral layer of peritoneum. And this cavity contains a little amount of fluid which is called the peritoneal fluid. This is that appear in red color, lining the wall of the abdominal and pelvic cavities is the parietal peritoneum. And the visceral peritoneum covering the different abdominal organs. The space in between the parietal and visceral peritoneum is the peritoneal cavity. Here we can see this is the parietal peritoneum, and it is reflected on the posterior abdominal wall covering the different structures. Here we can see in this transverse section that the parietal peritoneum is continuous with that of the visceral peritoneum. And it's the same, the parietal peritoneum on the posterior abdominal wall will be reflected and would form a double layer. This double layer will cover the viscera. So there is a continuity, it's the same layer, parietal and the visceral peritoneum, and this is the peritoneal cavity in between. What is the nerve supply of the peritoneum? This is an important subject. Parietal peritoneum is supplied by the lower 6 thoracic nerve and the first lumbar, and from T7 to 12 and L1. This is the anterior abdominal wall. The diaphragmatic peritoneum, or the peritoneum that lining the diaphragm, is supplied by the phrenic nerve. The peritoneum that is lining the pelvis is supplied by the obturator nerve, while the visceral peritoneum that is covering the viscera is supplied by the same nerve that supply the viscera, which are autonomic afferent nerve. So we have somatic nerve supplying the parietal peritoneum, and we have autonomic nerve supplying the visceral peritoneum. Here we can see it's the same nerves that supply the anterior abdominal wall from T7 to T8, T9, 10, 11, 12, and L1, also supplying all layers of the anterior abdominal wall. In addition to that, the peritoneum with the pelvis by the obturator nerve, and the diaphragmatic peritoneum supplied by the phrenic nerves. Peritoneal cavity in male, this is a closed cavity, that's it have no communication with the outside, while in female there is a communication with the exterior through the uterine tubes, the uterus, and the vagina. In this figure we can see this is the peritoneal cavity of a male, and there is no connection with the outside, while in female it is regarded there is a connection with the exterior through the uterine tube, through the uterus and the vagina. So there is a risk of spread of infection from the genital tract to the inside of the peritoneal cavity. Why? Because of this connection with the exterior. Intraperitoneal and retroperitoneal. What are these items referred to? Intraperitoneal. When we can say that this organ is intraperitoneal, organ that is almost totally covered with the visceral peritoneum. That's from all its sides, it's covered by peritoneum. Example on this organ is the stomach, jejunum, ileum, and spleen. All these organs are covered by peritoneum from all the sides. We can see here, these are the small intestine. Parts of the jejunum and ileum are totally covered by visceral peritoneum, and it have a mesentery, while the retroperitoneal structure is covered partially by visceral peritoneum. These are the retroperitoneal structure. When we can say that this organ is retroperitoneal, when it lies behind the peritoneum and it is partially covered with the visceral peritoneum. Example on these retroperitoneal structures is the pancreas, ascending colon, descending colon, kidneys, and the suprarenal gland. These are the retroperitoneal organs. Here we can see the kidney, suprarenal gland, inferior vena cava, aorta, the duodenum, except the first inch of the duodenum, the ascending and the descending colon. All these structures are regarded as retroperitoneal organs. We can divide the peritoneal cavity in general into two main parts, the greater sac and the lesser sac. The greater sac, this is the main cavity, and the lesser sac. The greater sac extending between from the diaphragm above to the pelvic cavity below, while the lesser sac, this part of the peritoneal cavity that lies behind the lesser omentum and the stomach, and is bounded superiorly from the diaphragm above and below in between the two layers of the greater omentum. And there is a connection in between the greater sac and the lesser sac through the epiploic foramen or foramen of Winslow. The greater sac can be further divided into two parts by the attachment of the transverse mesocolon into a supracolic compartment and infracolic compartment. Supracolic compartment and infracolic compartment according to the attachment of the transverse mesocolon. These are the two parts of the greater sacs, supracolic and infracolic compartments. نجي إلى مصطلح when the peritoneum duplicate or form a double layer, it will form certain structures. From these structures is the omentum. Omentum is a double layer of peritoneum that connect the stomach, connect the stomach to another viscous such as the liver or the spleen. We have the greater omentum and the lesser omentum. Lesser omentum is connecting in between the stomach and the liver. Here we can see this is the lesser omentum suspending the stomach, lesser curvature, and attaching it to the fissure for ligamentum venosum and porta hepatis, while the greater omentum descending down from the greater curvature of the stomach down and folded upward to be attached to the transverse mesocolon. We can appreciate that from this picture that the greater omentum contain certain amount of fat. So the greater omentum connects the greater curvature, this is the greater curvature of the stomach, descend down and ascend up to be attached to the transverse colon. It hangs down like an apron in front of the coils of the small intestine, and it's folded back on itself to be attached to the transverse colon. It has important clinical application. This greater omentum, or it's called abdominal policeman. From this figure we can see the first of all, A is the normal greater omentum. B, we can see that the greater omentum is wrapped around, it means covering an inflamed appendix. While in C, the greater omentum is folded upward toward the stomach and it's adherent to the base of a gastric ulcer. يعني هنا قاعدة موجودة في القرحة. The greater omentum, it have the ability to be adherent to the base of the gastric ulcer and it will sealing. So it is called abdominal policeman. So why we call it abdominal policeman? Because it have the ability to the localization of infection. It can act as a hernial plug, what can be used in surgery, and in addition to that, there is a problem of torsion of the greater omentum and causes a certain surgical case. The lesser omentum. The lesser omentum also, it is a double layer of peritoneum that extend in between the liver and the lesser curvature of the stomach. Can be divided into two parts. It is the same layer, but can be divided into two parts. The part that pass in between the liver and the stomach is called hepatogastric ligament, and the part that extends in between the liver and the first part of the duodenum called hepatoduodenal ligament. The lesser omentum attached from the lesser curvature of the stomach to the fissure for ligamentum venosum and the porta hepatis on the undersurface of the liver. The lesser sac يعني مثل ما شرحنا قبل قليل انه قلنا الجريتر sac قسمناه الى supracolic compartment and infracolic compartment by the presence of the attachment of the transverse mesocolon. الآن موضوعنا هو lesser sac أو omental bursa. This is space that lies behind the lesser omentum and the stomach. This space lies behind the stomach and the lesser omentum, and it extend upward as far as the diaphragm. Downward, it extends in between the two layers of the greater omentum. You can see this is the lesser sac or the omental bursa situated behind the stomach, and this is the lesser omentum. It have a left margin and it have a right margin. Left margin here, it is closed by the presence of spleen, gastrosplenic omentum or ligament, and splenorenal ligament or lienorenal ligament. So this is the left margin formed by these structures. The right margin is here, it is opened. راح يكون هنا right margin opens into the greater sac اللي هو the main part of the peritoneal cavity through the opening of the lesser sac, which is called the epiploic foramen. So this is the omental bursa, or the lesser sac is opened to the greater sac by the epiploic foramen. This is the epiploic foramen. Here we can see this is the greater sac, and this is the entrance or the foramen of Winslow to the lesser sac or the omental bursa. We can see that the lesser sac is situated behind the stomach. What are the boundaries of the omental foramen? We can see here that anteriorly this is the free border of the lesser omentum, containing the bile duct, hepatic artery, and the portal vein. This is the epiploic foramen. Posteriorly is the inferior vena cava, superiorly part of the liver, which is called caudate process or the caudate loop of the liver, and inferiorly we have the first part or first inch of the duodenum. This is the boundaries. Here we can see this is the anterior boundary of the epiploic foramen. This is the free border of the lesser omentum containing bile duct, hepatic artery, and posteriorly the portal vein, and posterior boundary of the epiploic foramen is the inferior vena cava. Thank you.